Deputy Maureen O'Sullivan and Simon Harris to the Minister of Health and HSC Services plan for 2013 for mental health services, and fill in the post and breakdown on the spending of the 35 million to date. You're sharing your time, Deputy O'Sullivan, with Deputy Harris, and you both have 2 minutes each.
Gormagat chance an overshow of lay, Kirsty Sloan to Intina. We tried to get this as a topical issue back in July, so it's been quite a while coming, so we're very grateful for the opportunity to discuss this today, and that you yourself are here, Minister, on this. In 2008, we were told that it was 1 in 7 people had a mental health issue. We know that recent figures are suggesting that this is 1 in 4. And a recent report from Headstrong showed that almost 1/3 of young people are experiencing mental distress. Now, I suppose we all experience mental distress of some sort or another, but for some people it's much more severe, and we do need the services there. The cross group in the Oireachtas, which is made of representatives from all the political parties, and I'm the independent person there, have put together, we did our own pre-budget submission, which I'm sure has been passed on to you. And I think it's very indicative of the seriousness of the issue and the way in which all of us are taking it, regardless of what political background we're coming from. I think supporting mental health of the population before it reaches a point of crisis makes very good economic sense. Now, the crux of this is that 2012, 414 staff were promised, 477 in 2013, and that looks fabulous on paper. It's almost 900 posts. But it was alarming to read in the HSE July report, to their census on staffing, showed the net increase of from December 12 to July 13 of just 192. Now, I did have this as a topical issue, for an aspect of it back in March, and it was Minister Brian Hayes said that the HSE aims to fill the remaining posts by the end of March 2013, but this is not happening. So the question is, what is the actual net increase? And another question is, of the 414 and the 477, how many of those posts in mental health are being taken up by people who are currently in positions in mental health services? And if so, who is doing their work? We know that the ideal composition for these community mental health teams, because that has been... sorry?
Thank you. Your time is up.
Oh, is it? Oh, beg your pardon. OK, we'll come back on the supplement.
Thank you, Deputy Harris.
Thank you very much, Gairlac, and I very much welcome the opportunity to join with Deputy O'Sullivan this afternoon to seek clarity in relation to mental health funding and to receive an update from the Minister for Health on delivering community-based mental health services in Ireland. I want to recognise the commitment of the Minister for Health and thank him for being in the House to deal with this most serious issue this afternoon. Deputy O'Sullivan has already outlined how serious an issue this is, and I know, Minister, you're very well aware of it. You don't need me to tell you that. I think it's heartening that politicians on all sides of this House, from all different political backgrounds and indeed civic society, are united in our desire to do more to promote positive mental health. And I do believe our cross-party submission, or our cross-party group submission representing all political parties, is possibly the only issue that we'll all unite on in this House in advance of the next budget. Clearly there's no room for complacency. We need to see a further 35 million allocated for mental health services in 2014 to build on the delivery of community mental health services. But I think, Minister, you'd recognise yourself right across the health sector and indeed right across the budget in general, allocating money in itself is not enough. We need to make sure that it's spent. We need to make sure that it's spent efficiently and effectively and in the areas that it's meant to be spent. And with that in mind, there are 3 key questions. Deputy O'Sullivan reiterated them. Of the 414 posts in 2012, how many were filled by existing members in mental health, and have those positions been replaced? Of the 477 in the service plan for this year, how many of them have been filled and will all be filled by year end? And can we have an actual net increase figure in mental health staffing? I know the July HSE staffing census shows a net increase from December 2012 to July 2013 of 192. So will we actually get to the roughly 900 places by the end of 2013? I'm proud to be part of a government that's continuing to invest more and more resources in mental health, but it is so important that we keep on probing and questioning to making sure we're getting value for money and delivering in the community. Thank you.
Thank you very much, Deputy Minister. Your 4 minutes.
Thank you very much, and I'd like to thank both deputies for giving me the opportunity to update the House on the current position in relation to the provision of additional funding for mental health in 2013. Following on from the special allocation of 35 million and 414 posts provided for mental health in 2012, an additional 35 million was allocated in budget 2013 for the continued development of our mental health services across a range of headings, including the development of forensic services and community mental health teams for adults, children, older persons and mental health intellectual disability. Excuse me. 477 posts have been approved from this allocation, and as at 26th of August 13, 220 of these posts have been accepted, with a further 24 posts offered to candidates. Of the 233 remaining posts, 162 were at various stages in the recruitment process. These posts are additional to the additional 401 posts funded in 2012, of which 397 have either been filled or are awaiting clearance. The National Recruitment Service creates national panels in anticipation of vacancies. On occasion, however, it's difficult to fill some posts for various reasons, including availability of qualified candidates and geographical location. In addition, specific specialist staff are required to fill a number of posts, and the National Recruitment Service and the Mental Health Services are working hard to further improve the process to allow for more bespoke and specialised panels to meet local service needs and maximise successful recruitment. I've received assurances from the HSE that the recruitment process for the new posts being funded in 2013 and any outstanding posts approved in 2012 is been given priority within the HSE. In recognising the pivotal role that primary care has in addressing the mental health needs of the population, €5 million was made available in 2012 for the provision of counselling services in primary care, specifically for people with mental health problems. A further additional €2.5 million has been provided this year for the continued rollout of this service from this special year's allocation for mental health. €4 million of the additional funding provided in 2012 and 2013 was also provided to the HSE's National Office for Suicide Prevention, and this additional investment has led to work being progressed on almost every recommendation in Reach Out, our national strategy for action on suicide prevention, including a number of new service initiatives in this area. The National Office for Suicide Prevention also continues to fund over 40 organisations and programmes which are engaged in the delivery of frontline services for people who are in emotional distress, engaged in self-harm, or who have been bereaved through suicide. I'd like to take this opportunity to reiterate the Government's commitment to the continued development of our mental health services in the community, in line with a vision for change and Reach Out, and our determination to tackle what is such a widespread problem in our society over the last number of years in relation to suicide itself. Thank you.
Thank you, Minister. Both deputies have 1 minute each. Sorry.
Right. Okay. Thank you for the reply, Minister. And I do acknowledge the positive that is going on. But I do think that there's a need for greater transparency. You know, this 35 million in 2012, we're not too sure exactly how much of that was spent on mental health. And I don't think that the mental health area should have to pick up the bill for the overspend in certain other departments of the HSE. So I'd like the HSE to be able to spell out accurately exactly where the 35 million is being spent on each of those 2 years. I'm just also wondering how many people have actually been transferred from residential institutions and residential care to community care. I mean, that was recommended back in the 1984 report, and I'm just wondering how much progress is being made on that. And I do want to acknowledge there was a meeting last night with the HSE on the new primary care centre that's being planned for the Summerhill area in the North Inner City. And I want to acknowledge the commitment to mental health services that are planned to go in there. But that's further down the line.
Thank you very much. Deputy Harris, you have a minute.
Thank you, Gerlach. Minister, thank you for that very helpful reply, which I think gives us a real clarity around the issue that wasn't in place up until today's figures. I take the point you make about geography and qualification. It's very important that we have people in the right places and with the right skill set. I just want to use this opportunity, though, to make a point. We need to be looking at prevention as well. We need to be looking at promoting positive mental health. And to be quite frank, Minister, it's not your direct ministerial responsibility, but in our schools there's a real void in this area. We've met, Deputy O'Sullivan and myself and representatives from other parties, with what's happening in some schools that are really leading the way. We know of the Scottish model. There needs to be a whole school curriculum approach to promoting positive mental health. We teach kids as young as 4 in our primary school to look after their teeth, to brush their teeth, to watch out for fillings, and we don't mention mental health with them until they get to the age of 15 in a kind of vague way in the SPHE. We need to look at an age-appropriate way of letting everybody know that they need to protect their mental health. And I would ask, that you and indeed the Minister of State with responsibility for mental health would look at coordinating that with the Department of Education.
Thank you very much. Minister, 2 minutes.
Well, again, to thank both deputies for bringing this up, and it is an important issue, and I know the one that's very emotive, especially at this time of the year in relation to children leaving school, the pressure they're under for exams, and the whole area of intellectual disability as well, and the issues that parents face and the concerns they have about the placement of their children in the adult services when they finish their school. And I had a conversation today with a member of my department too, who tells me that that particular issue is well on the way to resolution. I know it's not particularly related to the questions asked here, but I think it is a growing concern to a lot of people. Couldn't help but remarking on Deputy Harris's comments on this is an area we all agree on. I hope it's not the only area. I hope we can all agree that we're going to fight tobacco and put that particular issue out of harm's way from the point of view of the next generation of children in this country, and we'll soon see the benefits of that. I know nobody in this House will probably still be in politics. Well, I shouldn't say that about Deputy Harris. He could very well be here. But you know, the payback for that will be 33 decades away, but it will be enormous. I'd like also to take the opportunity, if I could, in the few seconds I have, to just say, you know, that there is a walk for aware starting here at the Dáil tomorrow week, out to Ashbourne and out to Meath, and I'd invite as many deputies and senators and anybody else in the House to join us on that walk. You asked me how many of the 35 million was spent in mental health. My understanding is that it was all spent in mental health. You've asked me further, which I think is a very reasonable question to ask, how many people have been transferred from institutional care to the community? And I can't answer that question, but I will revert to her and ensure that Minister Lynch does, because I'd be interested in that myself. I think that's very important. And the mental health issue of the curriculum in schools that Deputy Harris has raised, I agree completely with you, and I'll certainly raise it with Ministers Fitzgerald and Quinn. This is the first government that has put in place at a principal officer level a civil servant to cross the 3 departments to address issues such as intellectual disability, autism and obesity. And I see a real role here for this area of the mental health to be put on the curriculum. We are forever saying we want to destigmatise it. It should be treated the same way as any other health issue. So it doesn't make sense that we shouldn't start talking about it until they're in their late teens. We should be talking about it much earlier.
Thank you, Minister. Thank you.